This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I'm Valsa Williams and with me is Renuka. The headlines. Government is fully prepared in case of exponential rise in COVID-19 cases. Steps taken for testing capacity expansion in government and private medical colleges. No restriction on interstate and intrastate cargo transportation, states and union territories to ensure passes for employees of manufacturing units of essential commodities. Indian Council of Medical Research says 40 vaccines under development for coronavirus. Home Ministry asks all states and union territories to comply with Supreme Court directions on welfare of migrant labourers in relief camps. More than 5,000 crore rupees transferred to the accounts of 7.15 crore beneficiaries of Pradhan Mantri Ujjwala Yojana. Human Resource Ministry launches a web portal Yukti to combat COVID-19 challenges. A total of 918 fresh confirmed cases of COVID-19 have been reported in the country in the last 24 hours. This has taken the total number of patients to 8,447. 765 patients have recovered and been discharged from the hospitals, while 273 patients have died. Briefing media in New Delhi today, Joint Secretary in the Health Ministry, Love Agarwal, said the government is extra prepared in case of an exponential rise in COVID-19 cases.
देश हर तरीके से इस पर्टिकुलर महामारी से लड़ने के लिए तैयार है। जैसे जैसे सिचुएशन एमर्ज होगी उसको एंटीसिपेट करते हुए उसके लिए भी एक्स्ट्रा प्रिपेयर्डनेस की तरफ देश के एफर्ट्स रहे हैं और उसके साथ हम लोग मिलकर लड़ाई लड़ रहे हैं। इस लड़ाई को लड़ने में सरकार के साथ प्राइवेट सेक्टर सब हम मिलकर लड़ाई लड़ रहे हैं और उसमें सबसे मुख्य अंग है हमारा सपोर्ट, जो कि हमारे कॉमन सिटीजन जो आज हमारे साथ खड़ा होकर इस लड़ाई को लड़ रहा है और हम मिलकर इस देश की तरफ से पूरी दुनिया को अच्छी एग्जाम्पल दिखाएं कि जब पूरा दुनिया इस बीमारी से जूझ रही थी तो इंडिया ने एक सक्सेसफुल एग्जाम्पल दुनिया के सामने प्रस्तुत की।
Mr. Agarwal said based on the discussions at the level of the Health Minister and Home Minister, work is being done on an urgent basis to expand the capacity for COVID-19 testing in government and private medical colleges across the country. Joint Secretary in the Home Ministry, Punya Salila Srivastav, said the situation regarding essential commodities is under control. In the Home Ministry control room, officials of Ministries of Civil Aviation, Consumer Affairs and Railways have been working in coordination with states to resolve logistical problems. She said states and union territories have again been informed that there is no restriction on interstate and intrastate cargo transportation and they must ensure passes for employees of manufacturing units of essential commodities.
गृह मंत्रालय ने आज स्टेट्स और यूटीज को फिर से स्पष्टीकरण दिया है कि इंटरस्टेट एवं इंट्रास्टेट कार्गो की आवाजाही पर कोई भी रोक नहीं है, चाहे आवश्यक वस्तु या उसके अलावा कोई भी वस्तु ट्रांसपोर्ट हो रहा हो।
Ms. Srivastav also said the state governments are making door-to-door delivery of essential items in hotspot areas so that people do not have to step out. Dr. Manoj Murhekar of the Indian Council of Medical Research said in the last 5 days, on an average, 15,747 samples were tested per day and 584 of those were found positive per day. On a question regarding vaccine for COVID-19, he said over 40 vaccines are under development, but none have reached the next stage and as of now, there is no vaccine. Meanwhile, the group of ministers has approved the release of hydroxychloroquine to 13 countries after an assessment of stocks. The Hyderabad-based Centre for Cellular and Molecular Biology, CCMB, is hopeful of coming out with crucial conclusions which are relevant for practical applications relating to coronavirus. CCMB Director Dr. Rakesh K. Mishra told our correspondent in an exclusive talk that the institute has undertaken the genome sequencing of coronavirus jointly with the Institute of Genomics and Integrative Biology, IGIB. Dr. Rakesh, who is a member of the High-Level Advisory Committee of Telangana State Government, also advised to shift the strategy of coronavirus testing to antibody-based testing, which is cheaper and easy to do. The Home Ministry has asked all states and union territories to ensure compliance of Supreme Court directions on welfare of migrant labourers housed at relief camps. The Ministry has written a letter to all states and union territories to take necessary action while implementing lockdown measures to fight COVID-19 effectively. The court had directed that adequate medical facilities besides proper arrangements for food, clean drinking water and sanitation should be ensured for migrant workers at relief camps across the country. The court said that state governments and UTs should endeavour to engage volunteers along with the police to supervise the welfare activities for migrants.
Oil marketing companies have initiated transfer of 5,606 crore rupees to 7.15 crore Pradhan Mantri Ujjwala Yojana PMUI beneficiaries' accounts for availing free delivery of LPG cylinder under the Pradhan Mantri Garib Kalyan package. Booking of 1.26 crore cylinders has been done in this month by the beneficiaries, out of which about 85 lakh cylinders have been delivered to PMUI beneficiaries. There are 27.87 crore active LPG consumers in the country, with the PMUI beneficiaries accounting for over 8 crore. Since the lockdown, 50 to 60 lakh cylinders are being delivered daily in the country. All customers holding an installed LPG connection under Pradhan Mantri Ujjwala Yojana as on 31st March are eligible to get the benefits of the Pradhan Mantri Garib Kalyan Yojana. The scheme has started from 1st April and will continue up to 30th June. The government has provided over 28,000 crore rupees support through direct benefit transfer to around 32 crore beneficiaries under Pradhan Mantri Garib Kalyan Relief Package announced in the view of the COVID-19 outbreak. More from our correspondent.
Around 14,000 crore rupees have been directly transferred to approximately 7 crore farmers under PM Kisan scheme. The beneficiaries got 2,000 rupees directly in their accounts. 10,000 crore rupees were transferred to over 19 crore Pradhan Mantri Jan Dhan Yojana women account holders who received 500 rupees each in their accounts. Over 3,000 crore rupees were transferred to 2 crore building and other construction workers till yesterday. Over 1,400 crore rupees have been transferred in the account of around 3 crore Divyang, senior citizens and aged widows. Under the Pradhan Mantri Garib Kalyan Ann Yojana, government will release 12 million metric tons of food grain during April to June. It will provide for 80 crore people at 5 kg per head per month at no cost. Free rations have already reached 2 crore beneficiaries. The package included free LPG refills for the next 3 months to over 8.3 crore poor women under Pradhan Mantri Ujjwala Yojana and 50 lakh rupees insurance cover for healthcare workers. With Divakar, Anupam Mishra, AR News, Delhi.
This is All India Radio bringing you a special program on COVID-19. A reminder of the headlines before we move on. Government is fully prepared in case of exponential rise in COVID-19 cases. Steps taken for testing capacity expansion in government and private medical colleges. No restriction on interstate and intrastate cargo transportation. States and union territories to ensure passes for employees of manufacturing units of essential commodities. Indian Council of Medical Research says 40 vaccines under development of coronavirus. Home Ministry asks all states and union territories to comply with Supreme Court directions on welfare of migrant labourers in relief camps. More than 5,000 crore rupees transferred to the accounts of 7.15 crore beneficiaries of Pradhan Mantri Ujjwala Yojana. Human Resource Ministry launches a web portal, Yukti, to combat COVID-19 challenges. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
Minister for Human Resource Development Ramesh Pokhriyal Nishank has launched a web portal, Yukti, Young India Combating COVID with Knowledge, Technology and Innovation in New Delhi today. The portal and dashboard will monitor and record the efforts and initiatives of the Ministry of HRD. It intends to cover different dimensions of COVID-19 challenges in a holistic and comprehensive way. Speaking on the occasion, Mr. Nishank said, in the wake of COVID-19 threat, the primary aim is to keep the academic community healthy, both physically and mentally, and to enable a continuous high-quality learning environment. The portal is an effort of the HRD Ministry to achieve this goal in these difficult times.
मानव संसाधन विकास मंत्रालय से तमाम जुड़ी छोटी बड़ी संस्थाएं हैं, वो क्या क्या काम कर रही हैं और वो क्या क्या अभी तक उन्होंने अनुसंधान किया है, वो सभी इकट्ठा एक स्थान पर होगा। कोरोना वायरस के इस महामारी से जूझ रही है, इस संकट से उबरने के लिए ये तमाम संस्थान क्या शोध कर रहे हैं, क्या अनुसंधान इन्होंने अभी तक किया है, वो सभी जो उनके प्रयास हैं वो प्रयास एक स्थान पर प्राप्त होंगे।
Union Minister of Consumer Affairs, Food and Public Distribution, Ram Vilas Paswan, said the government will deal strictly with black marketeers and hoarders. In an exclusive interview to DD News, Mr. Paswan said more than 30 lakh metric tons of food grains have been sent to states and union territories. He also said that during the lockdown announced to contain COVID-19, instructions have also been given to states to ensure food supply to all, including people without ration cards.
हमारे साथ खाद्य और उपभोक्ता मंत्री रामविलास पासवान अभी ये बताने के लिए मौजूद हैं कि आखिर मंत्रालय ने जनता के लिए कौन कौन से काम किए।
देश की जनता को ये आश्वस्त करना चाहते हैं कि हमारे पास में खाद्यान्न की कमी नहीं है और जितना जरूरत है उससे हमारे पास में 2 गुना अधिक हमारे पास में खाद्यान्न है। हमको प्रति महीना चाहिए 7 लाख टन का, और कल तक की रिपोर्ट के मुताबिक 11 के रिपोर्ट के मुताबिक एफसीआई के पास में करीब 300 लाख टन जो है 299.45 लाख मेट्रिक टन चावल और 235.39 लाख टन गेहूं है। हम रेलवे को भी धन्यवाद देना चाहते हैं कि लॉकडाउन होने के बाद अभी तक 1056 रैक के माध्यम से करीब 30 लाख मेट्रिक टन अनाज का परिवहन हो चुका है। 3 महीना का हम लोगों ने सबको फ्री में राशन देने का निर्णय सरकार ने लिया कि 3 महीना तक जो 2 रुपये किलो 3 रुपये देते हैं उसको हम नहीं लेंगे, फ्री में देंगे 81 करोड़ लोगों को।
फ्री गेहूं या चावल जो राज्य सरकार को देने की बात भारत सरकार ने की है, उसमें कितना लगता है कि राज्य सरकार उठाव का काम कर रही है? कितने स्टेट जो हैं वो अब तक ले पाए हैं?
गरीब कल्याण अन्न योजना है, उसके तहत 111 लाख टन चावल और 11 लाख टन गेहूं का राज्यवार आवंटन हम 3 महीने के फ्री का कर चुके हैं। तो उसमें से 24 राज्य सरकार ने उठाना शुरू कर दिया है, बांटना भी क्या कहते हैं कि शुरू जो है।
जिनके पास राशन कार्ड नहीं है उनके लिए थोड़ी दिक्कतें हो रही हैं, उसके लिए विभाग क्या कर रहा है? राशन कार्ड जिनके पास नहीं है,
मजदूर ऐसे हैं जिनका राशन कार्ड घर पर है, वो कि यहाँ फंसे हुए हैं, इसलिए ऐसे लोगों के लिए 2 व्यवस्था है। एक तो है कि उनको हमने कहा कि स्टेट डिजास्टर फंड या नेशनल डिजास्टर फंड के माध्यम से फ्री में उनको खाना दिया जाए, और दूसरा है कि राज्य सरकार जो है जितना भी अनाज चाहे वो अनाज उठाकर 21 रुपये किलो गेहूं 22 रुपये किलो चावल लेकर के उनको डिस्ट्रीब्यूट कर सकती है।
अभी लॉकडाउन भी जब शुरू हुआ तो लोगों के मन में ये भय था कि कालाबाजारी हो सकती है। प्रधानमंत्री ने अपील किया कि लोग घरों में सामान अनावश्यक तौर पर न लाएं। तो आपके मंत्रालय ने और आपने कालाबाजारी को रोकने के लिए कौन कौन से प्रयास किए?
नहीं, देखिए उसमें हमने बहुत ही हिदायत दिया है कि जमाखोरी के खिलाफ में भी दिया है, एमआरपी के खिलाफ में भी किया है, लेकिन हमें इस बात का अभी तक खुशी है कि खास करके खाद्यान्न पदार्थ जो हैं चावल गेहूं दाल भी हमने 1 किलो प्रति परिवार सरकार ने निर्णय लिया है फ्री देने का। तो कहीं उस तरह की शिकायत जो है सो नहीं आ रही है। शुरू में हमारे पास में क्या कहते हैं मास्क और सैनिटाइजर के संबंध में जो शिकायतें आई थी, जो हमारा कंज्यूमर अफेयर्स का मामला है, तो हमने उसमें क्या कहते हैं उसका दाम हमने फिक्स कर दिया और हम पैनी दृष्टि रखे हुए हैं कि कोई भी चीज ये जो है कठिन घड़ी है और इसमें क्या कहते हैं कि व्यापारी हो जो भी हो सबका काम है कि लोगों को सहायता करे। प्रधानमंत्री दिन रात लगे हुए हैं, तो उस परिस्थिति में यदि कोई मुनाफा कमाने की इसमें कोशिश करेगा तो उसको बख्शा नहीं जाएगा।
In our series Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Dr. Purva Mathur, Professor of Laboratory Medicine, AIIMS, has said that social distancing is very important to check the spread of the virus.
The coronavirus spreads by droplets when a person coughs or sneezes. These droplets do not travel beyond 1 meter, and that is why it's important to maintain social distancing.
Dr. Nandakumar, Professor of Psychiatry, AIIMS, suggested to people to stay at home, spend time with family members and practice yoga.
We are going to overcome this crisis within a few weeks. In the coming few weeks, stay at home, spend time with the family, do household work, exercise, listen to music, sing with the family, do yoga, meditation, and take care of emotional needs of the family and yourself.
Tune in to our next bulletin to listen to other experts. Indian cricket captain Virat Kohli appreciated the efforts of Delhi police during lockdown.
It is heartening for me to know that the police service across the nation is helping so many people in these difficult times. I want to acknowledge the efforts of Delhi police, who have not only performed their duties with absolute honesty, but also taken food to the poor people on a daily basis, which is their utmost requirement. So well done and keep putting in the same effort.
Actor Nitish Bharadwaj appeals to do some creative work during lockdown instead of going out.
लॉकडाउन में हम बाहर नहीं जाएंगे, घर में बैठेंगे, कुछ और करेंगे, अच्छा साहित्य पढ़ेंगे, योग करेंगे, ध्यान करेंगे, अपनी त्रुटियों को चिंतन के माध्यम से, मंथन के माध्यम से देखेंगे हमने क्या गलतियां की हैं, इनको नहीं दोहराएंगे, व्यक्तिगत रूप से और सामाजिक रूप से.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. Madhur Yadav, Director and Professor in Medicine at Lady Hardinge Medical College, New Delhi, will participate in the discussion. Listeners can ask questions to the expert on toll-free telephone number 1800115767. 1800115767. You can also ask questions on telephone number 011-2331-4444. 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on Air app for updates.
The first COVID-19 patient of Manipur has been discharged from Jawaharlal Nehru Institute of Medical Sciences, JNIMS Hospital today. Details from our Imphal correspondent.
The 23-year-old patient was tested positive of novel coronavirus on 24th March and she had travel history from UK to Manipur. She was hospitalized at JNIMS Hospital. Speaking to AIR News, Director of JNIMS, Professor T.S. Bimo said, a meeting of doctors of JNIMS and Manipur State Surveillance Teams was held this morning and discussed the health conditions of the patient. As the patient has not shown any symptoms of COVID-19 for last 11 days and found negative of virus 3 times, it was decided to discharge the patient. He said the patient is physically fit now and having food properly. However, she will be in compulsory home quarantine for 14 days and avoid the rules of quarantine. JJ Thoksom, Imphal for AIR News.
Maharashtra School Education Minister Varsha Gaikwad today announced that the Education Department has decided to cancel the Geography and Work Experience paper of Class 10 board exams. She also said that annual exams of Class 9 and Class 11 have also been called off. The minister said that students will be graded as per previous semester's overall performance. Meanwhile, at least 134 people have tested positive for coronavirus in Maharashtra today, taking the state's tally to 1,895. The Mumbai civic body has deployed a team of 150 doctors and nurses for health screening of citizens residing in Dharavi, the largest slum in Asia. Our Pune correspondent reports that lockdown challenges are also throwing up opportunities for innovative ways of fulfilling the basic needs of the people.
Fulfilling the daily needs of the locals has become more challenging owing to close down of major vegetable markets and shops. But Pune Rural Police teamed up with Baramati Pattern Team for COVID-19 and came up with an app, Home Delivery, to send daily needs to the doorstep of the residents on a click. The app is sent via a link on social media and can be downloaded within 5 minutes. The resident can send order of the essentials through the app to the nearby mall or a grocery shop. Once the order is ready, it is delivered by the available volunteers of Baramati Pattern or by the shop owner himself. This idea has even eliminated the need of keeping social distance at the grocery shop and also strengthening the much needed effect of the lockdown. Manoj Kshirsagar for AIR News, Pune.
Our Kohima correspondent reports that amidst lockdown due to coronavirus, people in Nagaland celebrated Easter Sunday solemnly in their homes by holding special prayers, fasting and reading of scripture.
Churches in Nagaland for the first time has to forego the Easter celebration to stop the mass gathering of people to contain and prevent the spread of COVID-19 pandemic. The much-awaited service for believers, the Easter sunrise service, a worship service on Easter practiced by churches in Nagaland along with other Protestant churches in the world, religiously held every year at War Cemetery with attendees from various churches in the capital town of Kohima was cancelled amidst the nationwide lockdown and maintaining the code of social distancing. However, it did not deter the spirit of the believers to celebrate Easter, the resurrection of Christ, resounding the hopes and restoration in the shadow of this pandemic. For AIR News, this is Asanyo from Kohima.
In Karnataka, COVID-19 positive cases have reached 232 with 17 new cases reported till evening today. The state has seen 6 deaths and has discharged 54 patients found asymptomatic. Chief Minister B.S. Yediyurappa went around the city in Bengaluru today to see the enforcement of the lockdown. More from our correspondent.
Chief Minister B.S. Yediyurappa visited several parts of the city today to see for himself the city under lockdown. He spoke to policemen patrolling the important junctions and instructed them to ensure that the lockdown norms succeed. In some parts, the Chief Minister also spoke to people about the supply of essential commodities. In another development today, the Federation of Karnataka Chamber of Commerce and Industry has requested the government to postpone electricity bill payment of commercial entities, particularly MSMEs, for next 3 months. Sudhindra, AIR News, Bengaluru.
In Gujarat, Ahmedabad Municipal Corporation has made it compulsory for all citizens to wear masks at all public places till next order. The new order will be effective from 13th April. Briefing the media persons, Ahmedabad Municipal Commissioner Vijay Nehra said violators of this order will be fined ₹5,000. Those who refuse to pay fine will attract FIR and up to 3 years imprisonment.
With 32 new cases of corona-positive patients in the last 24 hours, the number of COVID-19 patients in Uttar Pradesh has reached 480. The state government today instructed all universities to start online education and upload e-content along with timetable so that there is no loss to the students of higher classes.
Chief Minister Yogi Adityanath instructed officials that there should be no problem to the farmers who are harvesting their yields, and department should ensure the smooth procurement of wheat. Number of corona-affected districts in the state has reached 41. In last 24 hours, maximum 12 positive patients were found in Gautam Buddha Nagar, followed by 10 in Agra. The state government is also taking action against the foreign nationals who were found violating visa norms. 17 foreign nationals has been sent behind bars after being found guilty of violating passport and visa rules. These include 10 nationals of Indonesia and 7 of Thailand. Bahraich police had arrested 21 persons including these 17 foreigners who were in quarantine. DG Prison Anand Kumar told AIR,
10 इंडोनेशियन नागरिक एवं 7 थाईलैंड के नागरिक को बहराइच जेल में लाया गया है। इनको कुछ दिन पहले आईपीसी की सुसंगत धाराओं के वायलेशन में, डिजास्टर मैनेजमेंट की धाराओं के वायलेशन में और फॉरेनर्स एक्ट के वायलेशन में इनको अरेस्ट किया गया था.
All these were quarantined earlier due to the risk of coronavirus infection, where their corona test report has come negative and still they are kept in quarantine barracks, and after 14 days they will be shifted to normal barracks. Sushil Chandra Tiwari, AIR News, Lucknow.
Bringing great relief for Kerala, only 2 new positive COVID-19 cases were confirmed today in the state, the lowest figure since the last few weeks. A report.
State Health Minister K.K. Shailaja informed that it is indeed a happy day for Kerala as only 2 COVID-19 cases were confirmed, whereas 36 people recovered from the infection today. At present, 194 patients are under treatment for COVID-19 in Kerala, which is the lowest number this month. A total of 179 people had recovered from the disease so far. The number of people under observation in the state also went down to around 1,16,000. Meanwhile, Christians across Kerala celebrated Easter strictly under lockdown guidelines. People attended prayers at their home watching online Easter services from church. They exchanged well wishes through phone and shared special Easter food with the needy. Many also involved in various activities against COVID-19. Like Sisters of St. Gemma's Convent, Malappuram was busy making masks, which they felt as the greatest offering for Jesus this time on his holy day of resurrection. Mayusha for AR News from Thiruvananthapuram.
In Chhattisgarh, 13 new cases of corona-positive patients have been found in last 12 hours, taking the number of COVID-19 cases in the state to 31. All these cases were reported from Katghoda town at Korba district. So far, 10 patients have been recovered after treatment in the state. while 21 other corona-infected patients are hospitalized and being treated in AIIMS Raipur. In Assam, all the political parties have favoured to extend the lockdown period. Talking to AIR, State BJP President Ranjit Kumar Das, who took part in the all-party meeting in Guwahati, said that all political parties complimented the efforts of the Assam government to contain the situation. Our correspondent reports that no positive case has been reported in Assam during last 60 hours.
Chief Minister Sarvanand Sonowal said that all political parties associated to work as Team Assam. The all-party meeting also extended gratitude to all the frontline workers who are working round the clock for the people of the state against the COVID-19. The Chief Minister also expressed gratitude to all political parties and assured that his government would try to follow all the suggestions made by the political parties. Meanwhile, the state cabinet meeting held in presence of Chief Minister Mr. Sonowal in Guwahati decided to follow the centre's directive for future course of action on lockdown. Manas Pratim Sharma, AR News, Guwahati.
In Jammu and Kashmir, the divisional administration is tirelessly reaching out to the people of Kashmir division to mitigate their hardships in the wake of the prevailing COVID-19 situation. More from our Srinagar correspondent.
Divisional Commissioner Kashmir Pandurang K. Pole has instructed for the uninterrupted supply of oxygen cylinders to district hospitals in the Kashmir Valley. About 1,500 oxygen cylinders are already available in the stores and additional supply will reach Kashmir soon. He has directed the Health Services Department to compile a district-wise requisition chart for meeting out the requirements of oxygen cylinders by district hospitals. Meanwhile, Lieutenant Governor G.C. Murmu has greeted the people on the auspicious occasion of Baisakhi. He has appealed to the people to strictly adhere to social distancing norms and avoid any public gatherings in view of the coronavirus pandemic. This is Sunil Kohl for AR News from Srinagar.
About 2 crore masks have been produced by around 78,000 self-help group members of 27 state rural livelihood missions. Rural Development Minister has said the masks have been supplied to the state health departments, local self-government, local administration, frontline workers, police officials and are also sold in open markets. They have also been distributed free to the rural households in many states. Self-help group members have now started making personal protective equipment like aprons, gowns and face shields. More than 900 groups in 9 states have produced 1,15,000 litres of sanitizers. Some members of the group have also been selling liquid soaps to guarantee hand hygiene.
The government is working to ensure that affordable medicines are available at 6,300 Pradhan Mantri Jan Aushadhi Kendras across the country. Minister of State for Chemicals and Fertilizers, Mansukh Mandavia, has said the warehouses of Jan Aushadhi centres are working day and night on a war footing to deal with the current situation due to COVID-19. During the lockdown, pharmacists of Kendras are delivering quality generic medicines at affordable prices to citizens. The mobile application Jan Aushadhi Sugam is also available for the common public to locate their nearest Jan Aushadhi Kendra and availability of medicines with its price.
Over 214 Lifeline Udan flights have been operated by Civil Aviation Ministry to transport essential medical cargo to remote parts of the country to support India's war against COVID-19. 128 of these flights have been operated by Air India and Alliance Air. The special focus has been on the Northeast region, islands, territories and the hill states. Our correspondent reports special permission has been taken to store cargo in the passengers' seating area and overhead cabins with due precautions. Public information related to Lifeline Udan flights is updated daily on a portal that was developed by the National Informatics Centre and Ministry of Civil Aviation.
The United Arab Emirates has offered to fly stranded Indians and citizens of other countries who wish to be repatriated if they test negative for COVID-19. The UAE's Ministry of Foreign Affairs and International Cooperation had sent out a note verbal in this regard to all the embassies in the UAE. UAE's ambassador to India, Ahmad Abdul Rahman Al-Banna, yesterday said the UAE has offered to test those who want to be evacuated. He added that those who test positive for COVID-19 will remain in the UAE where they will be treated. The Kerala High Court had yesterday sought the central government's response to a petition seeking a direction to bring back Indians stranded in the UAE in view of the coronavirus outbreak. And now, before we end the program, the headlines once again. Government is fully prepared in case of exponential rise in COVID-19 cases. Steps taken for testing capacity expansion in government and private medical colleges. No restriction on interstate and intrastate cargo transportation. States and union territories to ensure passes for employees of manufacturing units of essential commodities. Indian Council of Medical Research says 40 vaccines under development for coronavirus. Home Ministry asks all states and union territories to comply with Supreme Court directions on welfare of migrant labourers in relief camps. More than 5,000 crore rupees transferred to accounts of 7.15 crore beneficiaries of Pradhan Mantri Ujjwala Yojana. And with that, we end the special news program on COVID-19.